Thank you for viewing this recording of a free event provided by Next Village San Francisco for our community. Next Village San Francisco is a local nonprofit providing services and support that empowers seniors to live independently in their own homes. We welcome people who want to keep connected with their community as members, volunteers, and supporters. We host 30 to 40 free activities and events each month for the public, and our members have access to our network of volunteers. Learn more and get involved at nextvillagesf.org. We hope you enjoy this video.
Good afternoon, everyone, and welcome to Next Village End of Life Choices California presentation. Our speaker today is Ms. Linda Rowe, and she is a volunteer with the organization and has intimate knowledge of the particular End of Life Choices program that she has gone through with her own family members. So her perspective is really well-rounded, and we look forward to hearing more about how this program works. As usual, when you're a member of a village, we are an organization that does provide tremendous support to people, and we though do rely on our members to have plans in place for themselves as they age in case of an accident or an unfortunate event. And we think this will just be another one of those tools in your own personal toolkit that we want to make you aware of. So Linda, thank you so much for being here today. We're really looking forward to your presentation.
My pleasure. Thank you so much. As Jacqueline said, I've been a volunteer with End of Life Choices California for about 5 years. I was introduced to it through the doctor that stepped in when my mother wanted to know what her choices were. And the part of the beauty is we already were very organized. My family, it's a blessing. I'm the youngest of 4 children. I'm geographically the closest to my parents, plus being the youngest. My father died naturally about 8 years before my mother, but I was front row for all of the paperwork, all of the, I was the their attorney, their healthcare advocate, all of the above. So I basically walked every step of helping them be prepared for their end of life, and also knowing that I would be the in the front guard, basically, of helping shepherd them through this. And so about 4 or 5 years ago, my mother did choose medical aid in dying, which we will go over. But I can't stress enough the importance of pre-planning decisions, power of attorney that's now called power of healthcare. So what used to be power of attorney and your power of healthcare is now all in one. The presentation that we'll do today, Deborah covered in the email in terms of what your choices will be. However, what you will be getting after this presentation, the paperwork does include a lot of the planning that should go into planning for your end of life. All of that also is represented on our website, which we will also discuss. So this is kind of starting at the I'm terminally ill, I'm suffering, what are my choices? But we can talk about anything that you need to at the end. And please do, I encourage you to put your questions into the chat. Again, I'm with End of Life Choices California. This is advanced care planning and end of life options in the state of California. The mission of our organization is to provide Californians the information and support to successfully navigate their legal end of life options. Information being our incredible website, support being all of our incredible volunteers. And for the state of California, I think we're up to about 100 now. And when I started with them 4 or 5 years ago, we were probably at about 20 or 25. So that's very encouraging in terms of getting the word out and finding those who want to support it. What we hope you take away from this is the importance of sharing your values and end-of-life wishes with your loved ones, which I already addressed. What the legal end-of-life options are in the state of California, and what resources and support can be provided by End of Life Choices California. Usually I have my big, if I were doing a physical one, I have my big elephant stuffed animal, Waldo. Sometimes even if I stand in the middle of the room, no one acknowledges me. It's getting better that people like to talk about death, but talking about death isn't going to kill you. And I think people are finding that out. And the more we can normalize it, the better. Bring it into the conversation without being Debbie Downer. Generally, how we want our lives to end is at home with our loved ones, with our pain and discomfort managed, having our spiritual needs represented and respected without being a burden to our loved ones. All of this is rooted in conversation and communication with your loved ones and who you anticipate or want to be your shepherd and your partner through this process. Advanced care planning benefits. Your values and wishes are known and honored, less confusion and family conflict, and a gift of love. And again, walking every path of this, I can tell you that verbalizing your values and wishes to your loved ones, it does in fact cause less confusion and family conflict. And after the fact, you have no idea what a gift of love it is to those that will be left behind. This is an example of the values worksheet that's on our website. I'm going to go very quickly through these because apparently I picked the wrong slide deck. So this is the paperwork that I discussed earlier that's on our website. It helps you determine what your quality of life, living as long as possible. And you can see very important to not important. It's just a worksheet, but it starts the conversation. Advanced care planning, advanced healthcare directive. This is very important for, again, advanced healthcare directive form is for the person that you want to be to head the charge and have all your paperwork. It's written by you. It names your healthcare agent. The healthcare agent used to be called your power of attorney, instructions for healthcare, signatures, 2 wishes. Again, this is all available on our website. This is a dementia directive. Neurodegenerative diseases issues do not qualify for medical aid in dying. Parkinson's, things like that, but also dementia. A lot of questions we get about dementia, and unfortunately, it's currently not addressed. They're trying to address it in Canada. We'll see what goes on there. But again, this is a good talking point for your loved ones that says how long you want to live, you want aggressive treatment illness versus do not restart your heart. Again, these are all really good worksheets. Advanced care and planning for VSED directive. Again, voluntarily stop eating and drinking. That's called VSED. It's legal for everyone on the planet. In fact, the elderly, as they get older, this is basically what many of them do. They just lose their willing to live. They're not interested in eating, but you can consciously do this. And this planning directive helps the person that's going to be supporting you. Do not help me eat and drink. It just helps make clear your wishes. And when we talk about this, and then I'll clarify. Advanced care planning, the PULSE. This is not anything that you need until you're older and infirmed, living on your own with the potential of an ambulance coming is one reason you would need the pulse. But also, if you find yourself living in an assisted or independent living, the clinic at that place will have your pulse, your physician orders for life-sustaining treatment on hand to give the emergency people, that will outline physician orders for life-sustaining treatment, translates your advanced healthcare directive into physician orders for emergency personnel. Advanced care plan, the summary. Fill out values worksheet or make your values known. Complete your advanced healthcare directive. This combines your healthcare advocate and your healthcare wishes. Update advanced healthcare directive and your post. Now, this is the end of life options, which is what Deborah outlined in the email. End of life options are continuing your medical treatment. If you have a condition that is being supported by medication or treatment, you have the right to say, I don't want to do this anymore, and stop. Stopping this unwanted medical treatment. Palliative care, which we'll go into each one of these individually. Palliative care is pain and discomfort management. Hospice care is pain and healthcare management with the support of the healthcare system, which would include volunteers, medical equipment, anything you need. Hospice is remarkable. Voluntarily stop eating and drinking, which I addressed a minute ago, which is referred to as VSED. You'll hear this VSED and MAID. VSED, stop, voluntarily stopping eating and drinking, and MAID, which is medical aid in dying. This is what is the legal option within the California law. The first one being continuing medical treatment. Talk with your doctors about what the true expected outcomes of your treatment are. This would be, is the treatment worse than the disease? You've heard that before. If you're miserable and failing and the treatment they give you is going to make you miserable, but they don't think they can do anything about the disease. Continuing medical treatment. Sometimes the treatments offered can feel worse than the condition itself. A consideration, but again, an option, a consideration and an option. Continuing medical treatment, your personal decision being quality of time versus quality of life. Many feel that they will continue the medical treatment because they just want to get to Christmas. They just want to get to their grandchild's graduation. It is your choice and your option to weigh that. Stopping unwanted medical treatment, physician support is critical here. Examples include antibiotic therapy for infection, kidney dialysis, use of a ventilator, heart defibrillation or pacemaker. And just, I will, and nothing, there's no such thing as a personal question. So in the chat or when we talk, please feel free to ask me anything. I have no secrets. And the story I want to tell you is when my mother was in skilled nursing and she was miserable and my mother was very funny. And again, this was such a comfortable yet uncomfortable subject for us that we could make jokes. We deal with things through laughter quite often. And another story, 2 years before my mother was in this position, my aunt in Vermont, who also has the Options Act in Vermont, had decided to do voluntarily stop eating and drinking. So, and it was her only remaining sibling. So we had already been through the whole thing with Aunt Mary, which the choices she made back in Vermont, which helped with the conversation within my family, which we'd already been having. So VSED was topic. So we're in skilled nursing and my mother is miserable. And she said, well, you know, if it comes to voluntarily stop eating and drinking, this place will make it really easy because the food is awful. And, you know, so it just tells you where her mind was. And she really didn't want to do that. And then she had a pacemaker. So she thought the pacemaker was going to be her way out because she could just have it turned off. She was just going to turn off her pacemaker, and she was convinced she'd die in her sleep. So we consulted a doctor about that, and the doctor said, no, 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 you don't want to turn off the So this went on for a couple of days, her talking about turning off her pacemaker. And the skilled nursing, everybody was like, well, that takes a magnet, and we don't do that. And we're going to have to talk to the doctor. And the hospice nurse was nervous, and everybody was kind of fluttered about this talk about turning off the pacemaker. And then we had gotten to the point of talking to physicians about medical aid in dying. And the doctor said, oh my gosh, no, stop talking about the magnet. Stop talking about the magnet, because if you turn off your pacemaker, you might have a serious heart event in the night, which would then put you in a position of no longer being able to make the conscious choice of medical aid in dying. Well, that stopped the conversation about the pacemaker right there. My mom wanted nothing to do with that. So I think that's a very valid point, as we say that stopping unwanted medical treatment, stop your pacemaker. I don't know. Be careful what you treat, because you may need it, right? Kidney dialysis, your kidneys will fail. Then you would probably be eligible for MAID. So there's a lot of ifs and thens and things like that. But I just wanted to insert that little pacemaker conversation, because it was, thank goodness she didn't have a magnet to turn it off herself. Palliative and hospice care. A lot of people don't understand what the difference of this is. Palliative care is, you can get it at any stage of the disease, can have curative treatment if you want. It's offered in the home, the facility, or the hospital, and it's paid for by most insurance. Hospice care is, you get signed onto hospice care when you have 6 months or less to live. You only want comfort care. There's no curative treatment whatsoever. You can get it in your home, facility, or in the hospital. It's paid for by Medicare, Medicaid, and your insurance, and it's got tremendous resources for your support team. You snap your fingers and a bed shows up. You snap your fingers and a toilet accommodation, because it's just, hospice is remarkable. The common goals is they're both there to manage your symptoms of complex medical illnesses. It's about physical relief, it's about psychological relief, and it's all about the quality of your life. Voluntarily stop eating and drinking. The person stops taking all food and fluids. And this is the paperwork that I showed you a little bit earlier. This helps the person who is going to engage in voluntarily stop eating say, don't give me food even if I ask for it. Don't this, don't that. This is my commitment. Sometimes if a person with dementia or a neurodegenerative situation chooses voluntarily stop eating and drinking, they may forget what they're doing, what they've chosen to do. That paperwork helps remind the person that is supporting them, and it helps remind them that this is something they wanted to do. And there have been cases where the client, the patient, hate calling them patients, the client will videotape a message to themselves saying, remember, this is what you wanted. In other words, the support team, which is critical, can show the video to the person who's forgotten, and it's them talking to themselves, and then they'll say, okay, I get it. Okay. 24-hour support is critical. Family, friends, hospice. Hospice is critical for the family. Hospice takes care of the patient. The family takes care of the patient who's taking care of the family. Hospice is wonderful. Support, medical, family, hospice is really wonderful. Option for people who do not qualify for medical aid in dying, neurodegenerative diseases, autoimmune diseases, chronic pain, or any other condition. There'll be people with Parkinson's, with Lou Gehrig's. But again, voluntarily stop eating. Your body can survive without food, but about day 3, the loopiness of dehydration begins. And so it's very important that, again, you have a great team. And a little aside, my aunt, who, again, Vermont, lived on a dairy farm, was very, trekked the back roads of Vermont until a week before she died. She wanted this slower, more spiritual journey to the end of her life. So she chose voluntarily stop eating and drinking. She could have done medical aid in dying. And it was so interesting to the family to say, oh, that's typical Mary. And oh, my mother, Joan. Oh, yeah, Joan would just want to flip the switch. So they're two completely different experiences. And if the person has the choice of both, it's interesting to see which one they choose. Medical aid in dying, also known as MAID. It's a legal option allowing a physician to prescribe life-ending medications to a terminally ill and mentally capable adult to control the timing of their death. So it's the timing, because it's just that quick. They feel the same way 5 minutes before. California End of Life Option Act, again, it was voted in 2015, but it went into law in 2016. And I don't know if people know that Governor Brown was a Jesuit. So this kind of thing, one would think, would go against his beliefs. But he said, I do not know what I would want if I were dying in prolonged and excruciating pain. I am certain, however, it would be a comfort to be able to consider the options afforded by this law, and I wouldn't deny that right to others. Applaud. What do they do? This? Applaud for Governor Brown. We have him to thank for this. The eligibility for the MAID option. You must be an adult and a California resident. Physician's diagnosis of terminal illness and prognosis of 6 months or less to live. Must be mentally capable of making informed medical decisions and able to take the medication in a small amount of liquid independently. You must be able to self-ingest. It's 2 ounces, which is very, very little, but you must be able to do it yourself. The process. 2 verbal requests made to the attending, this prescribing physician, a minimum of 48 hours apart. So you call the doctor, you know the doctor that will prescribe, you found him, you call him and say you'd like to do this within 48 hours, you make the next request. 1 written request signed by 2 witnesses. 1 must be unrelated. The second, attending and consulting physicians and others on MAID healthcare team cannot be a witness. So 2 witnesses. And then the second consulting physician must confirm eligibility. Generally, you find the first physician, he will know someone that will be his consulting physician. But you must find the physician, make 2 requests, a minimum of 48 hours apart, then 1 written request, and then there will be a second physician to confirm the eligibility made by the first physician. I hope I did that right. The prescription process, the attending physician sends the prescription directly to a compounding pharmacy. The best practice is to leave the prescription at the pharmacy until several days before it will be taken to avoid possible expiration. That's up to you. Generally, my experience has been you can get it can sit in the refrigerator because it lasts for about 6 months. If it takes you 6 months to not carry through with it, maybe you've changed your mind, it's expired, and you throw it away, or it can always be renewed. Taking the medication. An anti-nausea medication is taken about an hour before the time chosen by the client. It's for anti-nausea and anxiety. There is a protocol for what you eat within 12 hours. Sometimes people can't go that long. You just don't want any dairy, anything like that that could possibly upset your stomach. The MAID medication is a powder and it's mixed in about 2 ounces of liquid just before the person takes it. This is a role quite often that volunteers from EULCCA can play a role because the hospice isn't involved in this or they're not comfortable doing it. The family member doesn't want to be the one to hand the medication to their loved one. So we are available at that time. Deep sleep generally occurs within 2 to 10 minutes afterwards, and that deep sleep progresses into a deep coma. And then within a period of time, the person's heart will just stop beating. 80% of the people die in 2 hours or less. This is a very relative thing because the medication, by definition, is meant to stop the heart. If the client is suffering from something unheart related, if they have pancreatic cancer, if they're young and they have a strong heart, but something else is good, there are a lot of different things that determine how quickly they go into a coma and how quickly they actually pass. Aid in dying medication is a comfort in itself. I can tell you that when my mother found that she was eligible for medical aid in dying, I saw the weight of the world literally lift from her shoulders. It was such a comfort to know that there was going to be an end to her suffering and that it was going to be peaceful and painless. And it can plan last days with loved ones. As I said, I have 3 older siblings, and at the time my mother qualified, you had to wait 2 weeks between the first request to the doctor and the second thing. So we had 2 weeks of her tapping her foot in skilled nursing saying, really? So every one of my siblings came in from out of town for 2 days, and we just kind of had a rolling cocktail hour. And it was absolutely wonderful. It was very positive. It was very loving. So, and it doesn't have to be that way. You can plan the quietest, most wonderful thing. But plan the last days with your loved ones, I have found in other situations, is a remarkable period of time. A person can change their mind and not take the medication. Up until the stuff can be mixed and in someone's hand, and then it can say, I changed my mind. It is, if one of our volunteers is in attendance, one of the last things that is discussed with the client is whether they know what they're about to do and whether they still want to do it. Just having it provides comfort and puts the person in control. Something I have witnessed myself, whether it's a disease or age, that makes a person want to end their suffering. That process has put them kind of in the passenger seat and not in the driver's seat for quite a while. And I see them feel like they've lost control of everything in their life. Decisions are being made for them. And what I've witnessed is they feel very empowered by making this decision themselves. So it's pretty wonderful. 1/3 of the people who fill the prescription never take it. They decide it's not that bad. They die naturally, just having it as a comfort in the other room. And somehow they let go of worry and can go peacefully on their own. Numerous safeguards are provided. This is not a willy-nilly thing. I don't want anybody to ever think that. They guarantee that the choice is voluntary, that the person is terminally ill and making this choice for themselves, and that they are clear of the consequences, and that the person has considered all their alternatives. Because by this point, they have numerous doctors and are kind of tired of talking about it. By law, MAID is not suicide. This has gotten, the conversation about this suicide versus MAID thing has gotten better over the last 4 or 5 years. And the most meaningful, it was never a question in my family, so this has not been an issue, but as I have been involved in this, one of the best lines I've ever heard is, suicide is ending the process of living. MAID is ending the process of dying. And it puts it that's pretty simple in my eyes. Death certificate shows the underlying disease as the cause of death. My mother's was congestive heart disease. It would be pancreatic cancer. It would be cancer, whatever. The death certificate will show what made you eligible for MAID, not MAID itself. And it will not, by law, prohibits any impact on wills or insurance. And as we just said, words matter. In my mother's situation, suicide was mentioned, assisted suicide was mentioned, the word killing was mentioned, all of which, if I could go back and slap that doctor. Best practice, medical aid in dying, assisted dying, planned death, patient-controlled death, or voluntarily stopping eating and drinking. It's not starving to death. How we can help. End of Life Choices California provides free confidential support for end-of-life planning. I love the fact that, years ago it was called our hotline that you could call and ask any questions. It's now called a warm line, which I love. And we get probably 10 to 12 calls a day. We have incredible volunteers who are all sitting with our computer database that can bring up doctors in the area, hospices in the area. If you need a volunteer to call and visit, they'll hook you up with a volunteer. Our warm line volunteers are remarkable. As I mentioned, our website, all those forms that I kind of flew past and I was just saving time, they're all available on our website. The planning, the dementia directive, all of that is on our website, which leads me to resources, which again, I will rave about our website. Everything, it's got book reviews, movie reviews, testimonials, all of the forms. It's just remarkable. So I really, really encourage you to visit our website. We can do home visits if the person just needs someone to sit and hold their hands and explain a little bit more about their options or help walk them through the paperwork. We have volunteers for all of that. Presentations and community events, something like I'm doing for you today. And then we have a virtual bereavement group. It's been so popular that we've just expanded it to two different groups. And my experience has been that all of this conversation, the time that it takes to talk about this, the time that it takes to go through it, there's something about the journey that made our bereavement a completely different animal from even the bereavement from after my father, who at 94 just died a natural 94-year-old death at home with a couple of fire drills, calling 911 when we were committed not to, all of the above. The bereavement of this planned loss of my mother was completely different from the surprise, what day would it happen for my father? So, and I think that's something that people share within the MAID environment. So the bereavement groups, regardless of how the family members feel about the choice that the client made, quite often it leaves family members flummoxed about how they actually feel about the choice that their loved one made. And our bereavement groups put you in a room with people who have had the similar experience. It's not just the death of a loved one, but it's the choice of the death of the loved one and a number of other layers. So I think that's one reason why our bereavement group has been so popular, is because everybody has experienced much the same thing. How can you help? Of course, we're tell people about us. We're a nonprofit. Tell people about the choices they have in the state of California, and that we're very fortunate to be in the state of California to have these choices. Most important, and as importantly, ask your doctor now if he'll support your request for MAID if you have a terminal illness in the future. Another little story, I went to see my own doctor a couple weeks after my mother died, and he said, "How are things going?" And I said, "Oh, well, my mother just da 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 da." And he looked at me and said, "I didn't even know that was legal." Now, this was 4 years ago. I think we're getting better because there's a lot more press, but I was mortified that my own doctor didn't know it was legal. So I would have to educate him before I asked him if he would support it. And so then fast forward years later, I went to see him again, and I guess somebody had just put their dog down or something. He said, "I can't believe we don't support the same for people." And he had scooted away like they always do on those little rolling chairs of theirs. And I said, "Oh, boy, you've changed your tune." And he turned around and he looked at me, and he had the look on his face like, "You're the one. You're the one that told me about," it was so gratifying for me to sit there after being so mad at him. And then in the next visit, I took my husband to talk about all these things. And he said he would actually be a consulting physician. So in 4 years, we went from a doctor who didn't know anything about it to a doctor who had educated himself about it, who was willing to come halfway in support of it. He was raised Catholic. He had conflicts, which respect. But it's really important that you talk to all of your physicians. I had a client once who had a number of comorbidities, and he was just kind of done. He was like, which one can kill me? I'm just so done. I've planned for this. I don't have children. I don't have family. I want out. I don't want to take these medications anymore. He must have had 6 doctors. As I educated him, he went out and educated every one of his doctors. I didn't know it was legal it was so rewarding for me to continue to support him. I felt like he was our advocate, our ambassador to it, educating doctors. It was just a wonderful experience. So talk, talk, talk is all I can say. I definitely recommend you sign up for our newsletter. And the reason I'm saying this is they only send something out once a month. Only. They don't sell your contacts. And even as a volunteer, I look forward to our newsletter because it will tell you something about the law. It will tell you something about a current client's experience. It will tell you about one of our volunteers. If you're interested in volunteering, it's really, I'm a fan. I guess you can tell. And volunteer if you're interested. It's really the difference between our organization from 5 years ago to today. I'm thrilled with some of the people that have come on board. When I first got on my first Zoom call, I could not believe the credentials of the people that I was fortunate enough to be talking to, from palliative care doctors to social workers to clinical social workers to hospice nurses to all of these volunteers who were doing such amazing work in their own field, but then stretching themselves to educate and support this. I was thrilled. And then, of course, we are a nonprofit, so donate to support our mission and keep our services free of charge to everyone. This is a picture I'm showing you of our website was redone about a week ago, and this slide has not been updated. However, when you go to our website, all of this is still there. It's all still available. It may just look different, so don't give up. I'm sure I'm very confident I'm talking to a very tech savvy group of people, if not the person next door will be. So I definitely encourage you to do that. It will tell you who we are, what your options are, what the law is, how to plan, ways you can help. The resources one is remarkable, how to contact us, and then any local events. the founders of End of Life Choices, one is based in Solana Beach, which is down in the San Diego area, but this organization is they very have it together in the Bay Area. So I would definitely, if you wanted to add some events to your next event, I would go to our event calendar, and maybe there's something y'all would be interested in. And there you have it.
Thank you for viewing this Next Village video recording. We hope you enjoyed it. Please help us spread the word and tell friends and neighbors about Next Village events and services for seniors and adults with disabilities in San Francisco. Visit our website to learn more about our vibrant, growing network, as well as to view our calendar of upcoming Zoom and in-person events and activities in San Francisco. Our website is nextvillagesf.org. Contact us to join our email list to learn about events and resources for seniors in San Francisco. And subscribe to the Next Village YouTube channel by clicking the button below.